Honorable Prime Minister of India, Shri Narendra Modi ji, health ministers from participating countries, ministers from various states of India, distinguished delegates. On behalf of my government, it gives me immense pleasure to welcome you all to New Delhi and to India. I hope you will have a pleasant stay and a very fruitful deliberations. It is fitting that the Global Call to Action Summit should be hosted by India. We have an impressive list of achievements to share and good practices that other countries may learn from. In turn, we hope that some of the successes of other countries that we will hear from during the next 2 days will help us to move towards sustainable development goals and move towards a healthier India. We are also here to forge a partnership between ourselves to renew the pledge to end preventable maternal and child death. All of us are indeed privileged to have among ourselves the Honorable Prime Minister of India, whose vision is to see a healthy world and healthy India. Health issues have been very dear to his heart, now as a Prime Minister and earlier as the Chief Minister of Gujarat state. He has given us valued guidance and provided exemplary leadership on all health issues and more so on issues relating to women and children. Today, when we all of us have assembled for Global Call to Action Summit 2015, ending preventable child and maternal deaths, I am happy to inform that as Chief Minister of Gujarat, he implemented an innovative initiative of e-Mamta using information and communication technology to ensure delivery of healthcare services to every pregnant woman and child. This has been scaled up nationally as Mother and Child Tracking System, MCTS. As a champion of convergence, he has set an example by launching the Beti Bachao and Beti Padhao movement. The Prime Minister's national campaign on cleanliness and hygiene, Swachh Bharat Abhiyan, has a direct bearing on overall health and well-being. We have a young population, we must make them healthy. We look at you, sir, to provide leadership not only to India, but to the globe on maternal and child health issues. It is indeed a landmark occasion when health ministers from priority countries join state health ministers of India and meet international academic experts, practitioners of global leaders from the corporate sector, civil society, development partners, and the media, and showcase the power of new partnerships globally as well as locally, deliberate on the methods to accelerate innovations and strengthen health systems delivery through a mutual learning process. I'm sure this is going to enrich the resources of knowledge of each of the country present here. While we celebrate successes, let us not only recollect the long road traveled, but also join forces to ensure healthy lives for mothers and children. While under 5 deaths are increasingly concentrated to sub-Saharan Africa and South Asia, the share of the rest of the world has dropped from 32% in 1990 to 18% in 2011. I am glad to report that substantial progress has been made in reducing under 5 mortality rates, not only in India, but in other countries. India is happy to report that our maternal and infant mortality reduction in the recent past has been better and sharper compared to the global averages. But what about the 19,000 children who die every day globally from preventable diseases and never live to see their 5th birthday? This August gathering is aware that while India has overcome polio, reduced maternal and child mortality, increased vaccination, intensified its mission Indradhanush, yet disease like diarrhea and pneumonia still remain challenges. Our ministry has launched intensive campaigns for diseases like malaria and tuberculosis and HIV/AIDS to raise awareness and provide health care for infants, children, and vulnerable populations. I am sure that there will be a lot of learning from other countries about ways in which these challenges can be addressed. Providing nutrition and addressing anemia are other priority areas for women and children, and our government is accelerating all efforts to see to it that we fight this disease and we fight this challenge and make it a success. While we are making all efforts, we must make sure that we walk the extra mile to reach the unreached. This is our priority area. The underprivileged and the hard to reach deserve the first attention. Equity must be the core of our thinking. Countries with higher burden of maternal and child mortality will need to make an extra effort. Today is an ideal setting where we will learn from each other and embark on new pathways to reach the underserved. India has already started the process by shortlisting 184 districts which need a concerted effort. It is time also to build on achievements and strengths, take advantage to ensure that new vaccines and improved healthcare practices reach the last mile to the disadvantaged, to those who lack access to service by using technology and trained health workers. A promise renewed requires sustained multiple sector action to improve health of the world's children. Various fora in this summit, like the marketplace and the panel presentations, will focus on each one of these areas, providing opportunities for countries to discuss challenges and pathways to transformative change. Some of the good practices in the area of RMNCH and A and participating countries will find a place in the marketplace that showcase best practices is a platform for sharing and learning. I hope you will visit the marketplace that has been inaugurated by Honorable Prime Minister and get a chance to view demonstration of effectiveness of theme entitled For Systems, Partnership, Innovations, Convergence and Evidence. I am sure under the leadership of Honorable Prime Minister, we are committed to the cause of maternal and child health. We will not only be able to move towards sustainable development goals, but also aspire for a better world for mothers and children. I take this opportunity to welcome my ministerial colleagues to the ministerial conclave, which will discuss the leadership agenda for change and help and define concrete terms the transformation that we would like to see in terms of maternal and child health outcomes for every woman and every child to survive and thrive is the best possible way. I also welcome my colleagues, health ministers, and officials and ministries and of various states. Distinguished delegates, I welcome you once again and I wish our deliberations every success. Thank you.